Welcome to the Learning About Dogs podcast with Kay Lawrence and Frances McCormack, and introducing her new collie puppy, Nika. This series is going to be focusing on all those questions that arise when you try and survive that first year with a new puppy. So welcome back to our podcast of surviving that first year with a new puppy. So full of joy, on and off. And we have Frances with her puppy, who's Nika, who's now about 4 months old. There's an age where we go from weeks to months, and it's about 16 weeks, 20 weeks is 5 months, and I start to talk about it at 5 months old rather than weeks anymore, because it's, unless you've got the calendar in front of you, can't remember what it is. So her big learning at the moment is definitely, I think, important on your agenda. Is more of a passive learning rather than a training thing, is getting them used to hands and how hands are going to make contact with their bodies. There've been baby puppies that we could put our hands down and pick up, and it brought them close to our faces, and that was full of pleasure and joy. But then when they get to 16 weeks old, they're getting a bit of a lump that you don't really want to pick up anymore, apart from the fact that often picking them up is taking them away from what they're enjoying. So particularly the smaller dogs start to resent being picked up about this age, because it's the end of pleasure. No, you can't do that anymore. Let's pick you up, put you up, pick you up, change your hair, and all this sort of stuff. So making sure that hands are only receiving all the things they can enjoy. I mean, this is, it's a wonderful time to be able to explore your puppy and get to know what they like and what they don't like. So how's it going with her, with your hands on?
She's always, well, ever since she learned that hands weren't for stripping the skin off, um, when she learned that hands were predictors of reward, she's been very receptive to all kinds of hand contact. So I've really just been continuing that and continuing to make it pleasurable for her. She particularly loves just the ends, just the sides of her ears being massaged. So I've been working from there, gradually sort of putting a thumb in towards her ear. And at the moment, because she's teething, I'm inspecting her teeth daily. So there are all kinds of things I can do around that area that
Mm-hmm.
are helpful for her. She likes to have her stomach stroked as well. So I've been doing that. And as she's falling asleep, if she's in that position, I'll massage her toes. And so then I can go in between the toes and pop out a nail and just have a look between them and so on. So I've
Yeah.
been
So
doing
this
that.
is sort of an evening routine where she's naturally sleepy.
Evening, but also after lunch.
Mm.
That's one of the times she likes to have a routine of
Nature's
getting up
sedative.
beside me. Yeah.
So yes, yes. So you've got some routines that at a place where you do this, so she knows that this is hands-on time.
Yes, yeah, on the sofa beside me.
So have a look also then at doing it when she's not expecting it.
Okay.
I know it sounds odd. So it cannot. So I certainly want my hands to be considered to be tools of pleasure. Yep. We can stroke them and massage them in a way that they cannot do for themselves.
Hmm.
Yeah. So this is one of the benefits of living with people that have got hands. Yes. And learning what they like as opposed to what we like. Finding the way they like to be stroked is maybe not what we would want to do. That most people like that sensation of stroking a dog on the palm of their hands. That long stroke along the coat. But for some dogs, that's just a bit too much to start with. They can find that a bit too uncomfortable. So you might just have to do smaller, gentler strokes. Yeah. And often people like to, rub a dog like it's in a friggin' washing machine, and it's like, oh no, the puppy doesn't want that. And as you say, if you're getting your fingers in her mouth, that's an excellent thing to, for her to be familiar with, because often fingers don't taste like they should be there, especially
Mm.
if they've got soap and other products on their hands. They'll often reject the sense of something going in their mouth that's not right.
Yes.
So keeping up, the familiarity with all the things that you'll do with your hands. So you're introducing her to hands are going to do things now that will be done by tools later on.
Yes, and in fact, I've started bringing some tools in. So we've been using a brush, which we've increased the use of that at her request over the past week. She
So I
really
presume the
likes it.
hand did what the brush was going to do to start with, so you could, stroke a coat with your nails a little bit, so it felt like a brush, and then that would
Yes.
transition or graduate onto a brush doing it.
And then showed her the brush and just very lightly touched her with it.
Mm, mm,
It's very helpful that her brother loves being brushed. So
good, good.
I take the brush off the shelf, and we have a soft enough baby brush. The bristles aren't, they're not so malleable that they don't kind of move through the coat at all. But
Hmm.
he really enjoys that, and I'll take that off the shelf, and he'll come and sit in my lap, all 25 kilos of him, and he'll enjoy being stroked with that. And of course, she wants to get in on that, so
Sure, that's good,
yeah.
good, good. I mean, this is not the age for the slickers and the combs. This is,
Mm.
that's too much metal work for those sensitive skins, certainly. But, if you've got a dog that's going to have a lifetime of grooming routines, they're long coated or, they'll need clipping and trimming a lot, this is the age to get them familiar with it and make sure it's comfortable. It's not a fearful thing to do. You don't need to introduce clippers when they're sort of 9 months old and have never met them before.
Mm.
Getting them used to something like that at this age is important.
Yeah,
Clippers for coats, I mean electric
yeah.
clippers. Yeah. So you're having a good look around her eyes and opening her mouth and having a look, see where everything is, see what's coming through.
Yes, yeah. And also using my finger in her mouth to massage her gums, so which
Okay.
again has been at her request. Sometimes she likes to sleep with one of my fingers in her mouth. So I've been using that to kind of massage her gums just around the molars, and she seems to really like that. Just a
Yeah,
very
yeah.
gentle little bit of rubbing there.
Mind you, when you see them chew on a piece of concrete, you think, actually, I don't think those gums are that sensitive. I don't know. 'Cause it's like, oh my goodness me, some of the things they'll bite down on.
Mm.
So, I mean, when they are changing teeth, it's, something like if you have an old pair of jeans, and you can cut the legs off and make an enormous great knot out of the legs.
Right.
So they can actually sort of not mouth it, but they can bite down on it as like a soft soother. Yep, and you'll see them doing that, and that's often when you'll see the pup that's got it on their teeth, and they're just not quite like they're sucking, but they're just biting down on it in a rhythmic way, and you'll see them close their eyes with the pleasure. So
Right.
it's not only that the gums need that work; it's part of the job of actually bedding the teeth that are coming through properly as they're starting to break through.
Okay.
Yeah, so anything that's that sort of, and then throw it away after about a month because it will be smelly and horrible. Yeah, and I think this is the age to do things with your hands that future strangers are probably going to do as well.
For example.
So well, something that you might need to take to the vets. The vet is going to hold their tail to stick a thermometer up their bottom at some time.
Hmm.
Yes, so just even if you introduce, one hand can be stroking, but the other hand can just put your hand around her tail. There we
Right.
go. Yep. You certainly to take blood, you're going to need to hold an arm still. A front leg is going to be need to held still.
Hmm.
And you can just hold it for 2 or 3 seconds and then go back to stroking. So we start to introduce with our hands that are familiar and comfortable and trustworthy things that strangers are going to do further down the road. So when a stranger does it, they go, yeah, that's okay. Yeah, I'm used to that. I've seen that before. Not that you're
Mm.
going to stick needles in them or prod them or anything else, but you certainly want to be handling them in a way that, for proper examination. Yeah.
Right. Yeah. I see a lot of people doing this with food. And from the sense I'm getting from what you're saying, it's the stroking that gives them pleasure, the touch that gives them pleasure, that is what's rewarding
Hmm.
that. But it's also being, I suppose, faded in so that it's not a here I'm grabbing your tail right now.
I think a lot depends on the dog. I mean, for mine, food and activity is going to be quite a stimulated dog.
Hmm.
So even if it's what you might consider a low-grade piece of food, at this age they are very hungry, and I want food to be associated with alertness, activity. Oh, what can I do? Are we trying? And quite a high level of arousal around food. So to me, this is more of a relaxed learning of hands rather than tolerating of hands to earn a piece of food.
I
There's that
see, yes.
difference of trying to use food for paying off something that you might not like.
Aha.
So I'd never forget being 8 years old, going to the dentist, and then being bought a Mars bar because I was good at the dentist. It's like, okay, so that's a bit contradicting. So, yeah, so I certainly think if you've got an older dog that has, I wouldn't say trust issues, but is unfamiliar with hands-on contact being trustworthy and pleasant, food can be a way to familiarize them with it, but it's still what I call a payoff for something that should be pleasurable as opposed to trying to teach them to do something for a piece of food.
That makes sense, yes. Yeah.
And when you look at somebody who's what I call got good hands with the dog, they will be able to manipulate the puppy and be confident enough with their hands that the puppy goes, yes, that's fine. Oh, and then you go back to stroking, that's lovely. But if somebody's a bit anxious about it, and they want to have a look at the dog's toenails, they'll grab it by the foot. Well, the puppy's going to go, oh, I don't like the look of that. But if you bring your hand down from the elbow and end up at the foot, the dog can become used to that routine that doesn't seem like you're trying to. Feet are so precious to the dogs that the risk of somebody grabbing them and hurting them means they can't escape. So there's
Mm.
that alertness of don't touch my foot. But if they're lying on your lap and you're busy stroking the main trunk of their body, then you just take that stroke down the leg. Ooh, and push that leg out there. Oh, that leg loves that stretch. Oh, and we've ended up with a foot. Excellent. So it's not that naive, I want your foot, I'm going to have a look at it. It's more that this is how your body can be felt and this is how your body can be touched. So it's more of getting your confidence with handling the dog's body and getting them familiar with what hands are going to do and how much they can actually benefit from that sort of hand contact.
Yes. And I suppose building all of that on the foundation of having good hands and touching a dog in a way that they find relaxing and enjoyable, could you perhaps give us some tips about how to find that for our dogs, their enjoyment?
Um, yeah, I mean, certainly you can see it at about 8 weeks old. You'll pick a pup up and you'll sit it down your lap and you'll give it a bit of a stroke. And then you just rest your hands, you stop them moving. Or you take your hands about inch or so away from the puppy, and the puppy goes, ooh, that's not nice, you've stopped. And you'll get a nudge, you'll get a reminder. Either they'll
Hmm.
come up and lick your face, or the paw will touch your hand, or they'll wriggle their body under the hand again, and without consciously being aware of it, we start the stroking again. So this is, you've obviously
Guilty.
fallen for that one already, yes. It shows us that the pup is aware that they can manipulate us to do things with our hands. Excellent.
Mhm.
But it also shows us that what we were doing gave them pleasure and they'd like some more of it.
Right.
So we're in a world where, learning is about seeking rewards and more and better rewards. If what you're doing with your hands is rewarding and it stops, learning's going to happen to try and activate that pleasant reward again. So in that gap, we can then not quite insert, oh, well, I'll do it if you let me touch your ear, but we can integrate the reward because we've got two hands. One can be doing the stroking while the other turns your ear inside out to have a look, puts it back again, and stroking and ear and stroking both at the same time. What
Okay.
more could be pleasant than having what I call invasive handling happening at the same time the other hand is doing a massage.
Okay. Yes.
Yep. So that the whole package of hands-on is delightful, absolutely delightful.
Mm.
Yep. And it's certain aspects of what we're going to. I don't live in tick country. Probably, how am I? In 50 years of owning dogs, I've only ever removed maybe 3 ticks. And I know the American audience is going to fall over laughing at this point, um, because they might come from a walk and have to remove 20. It's just, if you're in tick country, checking your dog's body for ticks is a lifestyle. So being able to run through their coat like a chimpanzee, lift all the coat, have a look at the base of it, check, 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 and then do things with that bit that's there. Got that one, got that one. Your pup's going to have to get used to this because that's part of their full life. Mine probably don't. But we are going to have to take our face down towards the dog and have a look at something in great detail. They need to get used to that. That's not a threat. So
Mm-hmm.
for a lot of dogs that, when they're 5 or 6 months old, if you held their face and they've got a tick right between their eyes, and you need to look at this and think, is that a wart or a tick? And you're peering at them closely, it could be quite alarming. So just doing the sort of, getting them used to now the veterinary type health procedures for the rest of their lives is important. Oh, she's on tick inspection. Yeah, have at it. Go on, have at it. So it's not something weird and wonderful further down the road. Just get them used to those sort of things. But we do need to also teach them to be quite still. And that will be a certain way of stillness that you hold their body. You might sort of hold their trunk or around the ribs, count to 3, and then start massaging them again. So they just get used to your hands doing 2 things. One is, do you want me to carry on, which is sort of a release of your hands. You take them away, give the pup a chance to say, oh, that was nice. Oh, start again, please. Or moving your hands, but then keeping your hands in contact and quite still. And if they remain still and don't start wriggling, you'll start the stroking again.
Mm-hmm.
So that, if you're going to do nail clipping or anything that needs close inspection, you'll need your dog used to being still without having to be forced to be still. Just be calmed enough to be able to be still while we do what we're going to do.
I can
We
see
should make a
that.
video on that, yes.
Yes.
I mean, certainly if you're going to do any of the showing, the breed showing, the dog's going to have their teeth inspected. Strangers are going to have to go over them in quite intimate details to check that all the parts are where they should be. And they will need to be felt, and they can't see what's going on. They just have to trust that when they're looking forward, whatever this stranger's doing behind their ears, it's going to be okay. It's not going to bother them. So, getting used to dogs for their adult life, very important. Very important.
Yes. And then how does the transition between you doing these kinds of same kind of handling that a dog would get in veterinary context, how does that transition to the actual veterinary context happen? Is there a kind of an intermediate step that people should be doing, or is it just a dog's
Certainly,
understanding of touch?
yeah, I mean, if I'm taking, well, it depends on, if you're going to put the dog on the table and say, I think there's something wrong with A, B, or C, I would be handling the dog to show the vet what I think is not quite right. So, in other words, the pup is getting used to my familiar hands, handling them in a way they're familiar with a stranger present.
Right.
Rather than hand the dog over and say, I think there's something wrong with his tail, with his willy, with his foot, and the stranger immediately jumps on the dog to have a look. I would prefer to handle the dog to show what the vet can then see. Then they might need to handle after me to check what it feels like to them, because their hands are going to have different experiences as to whether this should be as it feels or whether it doesn't. Or it could be a way a dog is moving, then they'll want to examine it in a closer detail. So, having them familiar with me doing it with my hands whilst the stranger's present. But I mean, there's one technique that I remember seeing 50 odd years ago. It was Barbara Woodhouse would do a little display at Crufts, and she would have an area where dogs that were fearful of being handled by strangers were brought to her for her miracle cures. and all you had to do was
Right.
take along a pair of gloves. Okay, so you'd come along, and I remember watching her with this Dalmatian that was highly suspicious of this strange woman coming up that was quite British and outgoing and who's this there and all the rest of it, you know. And she said, well, give me your gloves then, give me your gloves. And she put on this person's gloves and handled the dog without any trouble at all. So it was a scent transfer. So in other words, you could say it was like a scent target of familiar scent from the person was passed over to the stranger, and then the stranger could touch the dog without any anxiety from the dog at all. And
Right.
she'd do the same. Then she'd hand the gloves to somebody else, and they would come in and do the same thing. Or it could be a coat.
Hmm.
Yes, so something that the dog is familiar with scent-wise is transferred to the other person for handling. And it was just not a miracle, but yeah, that's an iron. That's worth remembering. For all the dreadful things that Barbara Woodhouse is supposed to have done, you know, there's a lot of our understanding that now we can absolutely bring round again. And everybody has collapsible crates thanks to Barbara Woodhouse. You know,
Right.
uh,
Yeah.
she did as much good as she did harm. You know, but it was of the age. That was what the
Yeah.
70s were about. So that scent transfer can really help. You know, not to say to your vet, would you mind putting on my gloves, hat, and coat before you touch my dog? But if you know that the dog's going to have to go somewhere, and you know maybe even stay with somebody you don't know, ask to borrow their coat so they can get used to your hands in the stranger's clothing. You know, I used
Okay.
to take my dogs to college, which was um, filled with teenage children, boys particularly, because this was computer skills. Which can I get my dogs get used to teenage boys and what they smell like? Oh, okay. Well, no, the boys didn't know what they were doing, but I would say, could I do some scent work with my dog around you kids at lunchtime? Yeah, and they used to think
Right.
it's hilarious. I used to hide tea bags in their shoes because, you know, that was fine. And then the dogs would have to go up and down the lines and smell the shoes and find the tea bags. Great entertainment. But they got used to the scent of, you know, male puberty, which you could smell at 10 miles, I can tell you. Um, so just getting the dog used to the stranger's scents, very important for future handling. Yeah, very
Yes.
important.
And I love the way this is once again building learning on the foundation of what's familiar.
Yes.
It's just such a wonderful way to think about all of the strange things in our world that the dogs have to get used to, including being touched in strange ways and in strange places,
Hmm.
but
Hmm.
building that on what's familiar and also what's enjoyable for them.
I mean, you know, puppy classes for me was not so much about the puppy getting familiar with other dogs and going to class. A lot of it was about teaching people to become familiar with touching the dogs. You know, and I'd say, okay, how many of you have got male dogs here? And, you know, half of them put their hands up and said, how many of you have actually felt whether both their testicles are in the right place or not? And everyone would go, okay, everyone, have a feel, let's have a check. It's up to you. You know, you own this dog. Husbandry is part of your responsibility for ownership. You need to check that it's developing right and it's
Yes.
developing correctly. And that's exactly how it should feel. Oh, great, good. And does your
Mm.
dog mind? Yeah, whatever. And then next week, somebody would come and say, I just had a look at my dog's backside last week and I thought that looked a bit odd. Would you just tell me whether, should I go to that? I said, no, they always do like that, you know. So
Mm.
it's this this gap that we should be familiar with our dogs' bodies as much as the dogs need familiar with being touched. Yes. Oh, should it
Right.
make that noise when I do that? Should it smell like that? Do I, you know, and it's not so much of the dog being familiar with us. That familiarity is also a safety net. Yes, if I'm not familiar with doing something, when it goes wrong, it's going to be even harder to cope with it.
Yes.
You know,
You,
teaching everyone to pick their dog up. We used to have a specially built wooden unit that was nice and solid, and I'd want everybody to be able to pick up their dog and put it on this unit. And if somebody said, well, I can't do it without my husband, I said, would you bring him next week? And I want to see the two of you be able to lift your dog up, because the day they can't because they're injured, or, you know, the car is too high or they're too old, you're going to be stuck. Oh, great.
yeah.
So, you know, puppy class was often less about what to teach the puppies and more about what we could teach the people with the puppies. Yep.
Yeah.
So they became more skilled and more comfortable doing stuff that we can only learn from experience of actually doing it.
Yes.
And
And
checking
I
teeth. Yes, all those elements.
and you see people getting into difficulty, and I've been there myself with, the animal needs eardrops administered,
Mm,
and you've never touched their ears before. I mean,
yeah.
I've been there with a cat, and cats don't like having their ears touched the best of times. But then what do you do, and how are you going to manage this? So I think having the animal understand that this is part of the picture of hand contact is
Yes,
so
yes,
useful, because it
yes.
means then that there's less to try to deal with, and I'm using scare quotes there, when the time comes to actually
Well, there's less
make the
stress.
yeah.
If you're not familiar with, folding those ears inside out and just tipping the head at the right angle so the drops go down vertically, when
Mhm.
you're familiar and comfortable doing that, it's easier for the dog.
Yes.
So it's not only the stress of, the vet saying, oh yes, and put the eye drops in morning and night. You're going, oh my God, how do I do that? Yes,
Hmm.
or they've given you a tube of ointment to put in the eye. Um, and they've done it 150 times. You're now thinking, how do I hold my head? And and where do I put it? And how do I get it on? And what's the easy way to do this? Those sort of elements. We also used to practice giving liquid medicines, and I used to go around with a series of treats for the dogs, and everyone would have to give tablets, and how do you get it down the dog when they don't want to eat? And what does it look like when they swallow? And you don't massage the throat. So you get your tablet and you pop it to the back of the tongue and you shut the mouth. But then you put a piece of cheese or meat just in the front of their nostrils, between where their nostrils and their upper lip is. And the tongue will come out to get that piece of food off there because it tickles. And when that tongue comes out, the tablet goes down the hole.
Ah.
So it's never a question of shutting the mouth and then massaging the throat. It was
Right.
about getting the tongue to come forward to lick their nose, and you put honey or something on their nose, and I can assure you the tablet's gone. So it's those little things about, keeping the mouth shut and opening up the side of the mouth where the flap is on the corner of their mouth. You've got an enormous great pocket there to stick one of these needleless syringes and squirt some cough medicine down there or some
Hmm.
other liquid you want them to take. It doesn't have to go between the teeth. It can easily. So we'd practice that as part of you're learning how to live with a dog. You're learning all these elements that just, anticipate stress further down the road. We'd have a cling film evening. So I'd bring down, so I'd get half a dozen rolls of cling film and I'd cut them in half so it's only half the length. And everyone would have to wrap various parts of the dog in cling film. And it's one of the safest ways to be able to cover injury. It's sterile, so it keeps whatever's injured covered, and it also stops blood going all over the inside of your car while you're on the way to the vets.
My
So it's,
goodness.
keep that roll of cling film ready to go, and it does. Oh, put some cling film around his leg or his paw or anything else. It sounds easy, but you want to practice it before you need to do it. You really want to
Yes.
practice it, especially if they've the type that wags their tail and hits the furniture.
Mm.
That blood can get everywhere. On the ceiling, all around the inside of the light fitting in the car. Oh, cling film.
Wow.
And when we used to do the search and rescue out with the dogs on the mountains, you'd get cuts and bits and pieces, and always carried a roll of cling film as our first aid kit for the dogs and people. Yep, cling film, wonderful thing.
That's a completely new one for me.
So
Amazing.
we had a lady come, because it was, I'd say, next week's veterinary night or next week's handling. And then from there on, we'd always do a little bit more each week to add to the repertoire. I remember this lady coming down with a bag from Sainsbury's, and she had a wolfhound. And wherever they lived, she'd never had to pick up the dog's poo, or she'd done it with a shovel. And she says, well, we're going away next week, and I know I have to clear up after the dog. She says, but I know all you know how to do this, but how on earth do you get the poo into the bag? So she had this enormous Sainsbury's bag. It's like, oh, bless. So we made her go practice in the car park. Oh, right, she gets to put your hands inside the bag. Yes, of course, I should have known that. She just didn't know who to ask. It's not the sort of thing who do you ask? Not the sort of thing you ask a
Yes.
vet, is it? Yeah.
My- A very
Ah,
valuable lesson for us all
hmm.
on trying to learn as much as possible about handling and caring for our dogs, because there will be a day when we need to use it.
Oh yes, and
Yeah.
picking up poo is part of animal husbandry, and you should know what it looks like. You should
Mhm.
know what is normal, and when you go, "Ooh, who did that?" You need to know which of your dogs did that because that's not quite what it should be. Yeah,
Absolutely.
I mean, she said her husband didn't. Her husband said the dog didn't so much, have a shit as lay rope. Oh right, brings up the picture. So I think we'll leave it at that for that.
So
But
both
yes.
hands in the bag then, yeah.
Oh my goodness me, yes. Yes. Yes, if you want to know, ask about bags and poo, talk to dog walkers. They are the most experienced and they can do like 3 loads of pickups and knots all in one go. It's just like, oh goodness me, that's a skill. When you're running out of bags, how do you get that extra bag to take another bit? Yes. Lovely. Okay, so I think we'll end on that note as dog trainers normally do. Thank you very much again, Francis. Good luck with
Thanks
your
to you, Kay.
pickups. Cheers then. Thank you for listening. We shall be following Nika's first year through the podcasts. If you would like to learn more, please have a wander around our website, learningaboutdogs.com. We have many, many articles and lots of courses that you can explore. We also have Facebook pages, which is Kay Lawrence and Learning About Dogs. So if you have any questions on first year topics or anything else you'd like us to focus on, please use the Facebook pages and ask. See you next time.